Here's a question many cancer patients are unclear about. If antibodies are present, or if I have tested positive before, should I still get the vaccine?
The recommendation right now is to go ahead and get the vaccine, partly because we don't know the natural immunity from the infection, how long does it last. So it seems like the antibodies can start to wane after the infection. And again, we don't have a lot of data on it, but it looks like 3 to 6 months. It might start waning, at least to the level that we can detect. Now, whether that is sufficient or even the undetectable levels is protective against a future infection, we don't know. There have been some reports of people getting a second infection, even though they have been infected before. Again, scattered reports, we don't know how widespread that phenomenon is going to be. So given all these, I think the current recommendation would be to go ahead and get vaccinated. We generally tell people to wait for 2 to 3 months after the infection to go ahead with the vaccination.
Is the idea of pre-screening, especially for cancer patients maybe who may be at risk, to see whether they have antibodies, be an effective thing to decide which vaccine they should get? What's your thoughts on that?
You look at the Moderna and the Pfizer trials, and they said, over 90% effective. Look at the AstraZeneca trials, it's like, they recorded 70 to 80, 85%, and the J&J, or again, we said about 80 to 90% effective. Do these numbers mean much? It's really hard to know. I think partly because they have been tested in, again, different countries, different times, as the virus was continuing to change its characteristics. So one could argue that maybe the vaccines that were tested later on, when maybe some of the mutants were already there, might be more effective. But we don't know. I think at the end of the day, the 80 versus 90 is not something we would decide a vaccine on. The fact that, yes, if something was only 10% effective versus 90%, yes, it's a totally different story. So based on the numbers we have seen, I would say whatever you can get to first. If you don't want to get jabbed twice, maybe you go with something it's only one dose. But that may be the only distinguishing factor here. But nevertheless, I think we have to just get the vaccination with the first vaccine that we can get our hands on.